Hi, my name's Kelly O'Brien. I'm the Dental Assisting Program Coordinator at NHTI, and I want to talk to you about the field of dental assisting and how it can actually lead to other opportunities that you might not have realized. So first, I want you to think about your career goals. Are you interested in becoming a dental assistant, a dental hygienist, a dentist, a dental office manager? Or maybe a combination of those or something else completely. Well, keep that in mind during the presentation because we're going to circle back to this. All right, so what does a dental assistant do? Well, the duties of a dental assistant are among the most comprehensive and varied in the dental office. You do a lot of different things throughout the day. Of course, you're going to assist the dentist during a variety of treatment procedures. So that'd be like an exam, filling, crown procedure. You will take dental radiographs or x-rays if you're qualified to do so. You'll ask about the patient's medical history and take vital signs. You may serve as an infection control officer. You will definitely disinfect the treatment room and be involved with sterilizing the instruments. So that is very important because we want to prevent the spread of any transmissible diseases. You will help the patients to feel comfortable before, during, and after their treatment. You will give the patients oral care instructions after their procedures. So after you have a filling at the dentist, what do they tell you to do when you go home? You will teach patients strategies to maintain their oral health. So you'll show them how to brush or floss, or you might talk about nutrition and how that affects their oral health. You'll take impressions of the patient's teeth in order to make study models, again, if you're qualified to do that. You might perform office management tasks and communicate with patients, schedule their appointments, answer the phone, order supplies, and a number of other things. As a graduate dental assistant, so a graduate from a CODA accredited dental assisting program, which NHTI is, we are the only one in the state of New Hampshire. So as a graduate of our program, you will be qualified to take dental x-rays, polish teeth, place dental sealants, whiten teeth, monitor patients that are using nitrous oxide, make temporary crowns and bridges, and several other things. Let me tell you a little bit more about NHTI's professional certificate in dental assisting. Like I already mentioned, we are the only CODA, that's Commission on Dental Accreditation. We're the only CODA accredited program in the state of New Hampshire. The dental assisting program can be completed in as little as 10 months of full-time study, or there is also a part-time option available that would take 2 years. Our graduates are eligible to sit for the Dental Assisting National Board National Certification Exam. So you would then have the credentials as a certified dental assistant. You can earn an associate degree if you complete additional coursework, and I'll talk about that more in a few minutes. And like I mentioned on the last slide, graduates of the program at NHTI are qualified to expose dental x-rays, apply fluoride treatments, place sealants, perform coronal polishing, make temporary crowns, take impressions and bite registrations, monitor the administration of nitrous oxide, remove sutures, and perform orthodontic duties. There are other roles within the dental office, so you may also take a position as an administrative dental assistant. You would definitely have all of the knowledge in the dental field by completing our program that would make you effective in that role. You may become an insurance coordinator at some time in your career, or the treatment plan coordinator, or even the dental office manager. And of course, there's always the opportunity to be an assistant in a specialty dental office. For example, in orthodontics, oral surgery, pediatrics, periodontics, endodontics, that's root canals, or even in public health. Now, you also have room for career advancement after completing a degree in dental assisting. One thing you might pursue would be becoming an EFTA, an expanded functions dental auxiliary. You would complete additional training for that, which we do offer at NHTI. And with that training, you would be able to place, contour, and adjust direct restorative materials. So essentially, you could place a filling material into the tooth. That program is available to a dental assistant or a dental hygienist. Either one could become an EFTA as well. You might move on to become an educator and train the next generation of dental professionals, like I do. That would require at least a bachelor's degree if you decided to do that. Or you might decide that you want to become a dental hygienist. And maybe you're already thinking that right now, that you want to be a hygienist, but you're just not sure if you're ready to take that step. As a dental hygienist, you would be able to perform the dental hygiene assessment, remove the calculus and plaque, so those hard and soft deposits on the teeth, and definitely provide a lot of patient education. Many of our dental assisting graduates do go on to pursue a degree in dental hygiene, but not all of them. A lot are also happy with their career as a dental assistant. If that's something that you're thinking about, this is a pathway that could work for you. First, you would apply to the dental assisting program. You would complete your dental assisting professional certificate at NHTI. Then you could work as an assistant while you apply to the dental hygiene program. Then complete the dental hygiene program at NHTI and eventually become a registered dental hygienist. And if that's your goal, this is an excellent pathway for you. The benefits of becoming a graduate dental assistant before going on to becoming a hygienist. One is that you're already going to have a basic knowledge of dental terminology, which is going to put you one step ahead when you start the hygiene program. You'll have that experience working with patients in a dental office, and it really helps you have a certain comfort level and confidence as you begin then working with patients in the dental hygiene program. And you'll have more skills when you seek employment in a dental office. Having a background in assisting and hygiene makes you a very valuable and versatile employee. And that's the path I chose. I have a background both in assisting and dental hygiene. Another thing you should know if you're thinking about ultimately pursuing dental hygiene as a career is that if you come through NHTI's dental assisting program first, you can earn up to 10 points towards admission into the dental hygiene program. And if you've already researched that program, you'll know that it is a competitive program to get into. So earning those 10 points is significant when it comes to being accepted into the hygiene program. Your English composition, communications, and introduction to psychology courses are part of both the assisting and hygiene program. So you would already have those 3 completed and you wouldn't have to take them again if you go on to the hygiene program. Dental materials that you would take in the dental assisting program would transfer into dental hygiene. So that's one less course that you would have to complete in the hygiene program. And with dental radiology, you would have the opportunity to test out of taking the dental radiology course in the dental hygiene program. A lot of times students will test out of the laboratory portion of dental radiology and still take the lecture portion when they're in hygiene, just as a refresher and to make sure they're prepared for their dental hygiene exams. Now, if you're not considering dental hygiene, one other thing you might consider is getting an associate's degree. And at NHTI, you can get an associate's degree in general studies by transferring credits from the dental assisting program into that general studies degree. And you would actually already be over halfway done with earning your degree in general studies. 36 credits from the dental assisting program would transfer in, and that would leave you with only 26 more to complete in things like math, laboratory science, social science, humanities, and liberal arts or other sciences. All right, I want you to think back to your career goals that we talked about at the beginning, and has any of that changed? If you thought maybe perhaps you wanted to be a dental hygienist, are you now thinking, wait, I want to be an assistant and a hygienist? Or maybe the duties of a dental assistant sound like a lot of fun to you, and you want to explore that and see if that's where you really fit in. If you are interested in admissions information for the dental assisting program, I will let you know that our admission requirements is that you have to have a high school biology or chemistry course with a grade of C or higher. You have to do 20 hours of observation in a dental office, and you have to complete an interview. And of course, you also have to fill out the application. For the admissions deadline, you'll want to check on the NHTI website. Our program begins in the fall, so usually the admissions deadline is somewhere around March. And to apply, you'll just contact NHTI Admissions. I have their email address here for you, their phone number, or you can go directly on nhti.edu and follow the directions for applying there. If you'd like more information about the dental assisting program, feel free to contact me at any time. The best way to reach me is by email. So my email address is kobrien@ccsnh.edu. And I also put the link here so that you can go to the NHTI Dental Assisting website for more information. Thanks for listening, and I hope that you pursue a career in dental assisting.